So I think that people living with MS really need to feel empowered that they have some control over their disease. It's a disease where people feel very like they've just lost control over everything. What if I wake up in the morning and I can't see, or I can't walk, or I can't feel something? And fortunately, our current armamentarium of high efficacy therapies has changed that for our newly diagnosed patients, but they're still living with this history of those things from older folks who have MS. So I think that integrative medical modalities integrative medical modalities and lifestyle medicine really give people living with MS the onus to take control of their disease. You can control what you put into your mouth with food, and we know that food makes a very big difference to the health of the body, to the immune system, to the inflammatory system. You can control to some degree your stress level, right? We can't always control our stress level, but we can control our reactions to it. We can try our best to control our sleep, our social environment, to move our bodies to the best that we can, and then to seek out these other modalities of symptom management that are harmless. So really the worst thing that can happen to a person in an acupressure session is that nothing changes. There are forms of integrative medicine, holistic or alternative medicine that shouldn't be used in people who are having psychotic events or have severe histories of severe PTSD. But some of these hands-on modalities, again, the worst thing is that they might not help. I think it's always important to look for licensed and certified individuals for modalities like acupressure, acupuncture, massage, and to make sure that the other potential harm could be a financial one. So make sure that prices are reasonable and things like that. But I think that it gives a person living with MS the opportunity to say, I'm going to seek out some additional ways to manage my disease that I believe in and that work for me, in addition to disease modifying therapy. And I think that symptom management is a big one here because many of the things that we do for symptom management produce side effects. So certainly physical medicine and rehab, our rehab colleagues, PT, OT, speech do a wonderful job of providing patients with forms of symptom management that don't cause side effects. However, a lot of our medications do. So a person might, for example, have spasticity and have to take such a high dose of antispasmodic medication that they're asleep, or maybe their medication for neuropathic pain makes them constipated. So I think symptom management is definitely an overlooked, we focus a lot on it, right? But I think the downsides of symptom management are overlooked in improving the quality of life of people living with MS. And that is really where these lifestyle medicine interventions can come in handy.